Good morning, everyone. Happy Sunday. Hope you're all doing well. I'd like to invite you to the MBC Understanding the Legal Rights and Benefits. Our speaker today is Dr. Monica Bryant, and I'd like to turn this over to her. Thank you.
Thank you so much. I am delighted to be here. Although I have to admit, you did give me a promotion because I'm actually not a doctor.
I saw the JD.
Well, so, I keep arguing in my family that I should get called doctor because I do, in fact, have a Juris Doctorate, but it turns out that's not how things roll. So forgive me as I'm having, of course, Zoom technical difficulties. Here we go. Okay, so hopefully you all can see my screen now. I'm delighted to be here talking to you, even though I so wish we were all in person in LA together. My name is Monica Bryant, and I'm a cancer rights attorney and chief operating officer for a nonprofit called Triage Cancer. And for those of you who aren't aware, Triage Cancer provides education on all of the legal and practical issues that may impact individuals that are diagnosed with cancer and their caregivers. And lots of times people are very confused about what is legal about cancer, but the reality is almost everything is. And so we certainly have information around health insurance and employment, and disability insurance and finances, but also information around estate planning and all of those other sort of practical pieces that come up quite often. Now, I'm sure you are all very familiar with the term financial toxicity, which has certainly become the buzz term over the last several years, in that the financial impact of a cancer diagnosis can be as significant, if not more, than the physical impact. And while I think that it's important that we have a name for this thing now, it's certainly not a new problem. And one of the reasons why it's been so hard to address financial toxicity is that there are multiple contributing factors. And I would argue that the number one most significant factor is health insurance status. Now, certainly that could be about, do you have insurance or not? But more often it's about, do you have the right health insurance for you? And then are you effectively navigating those policies? Certainly the employment changes that can occur after a cancer diagnosis are going to impact finances. And then all the things in life that normally impact your finances, like relationship changes or moving, those things keep happening even after cancer diagnosis. So at Triage Cancer, we really try to provide education and information about all of these different factors so that people can start to make more educated decisions for them. Now, in this country, there are 3 places we get our health insurance. The largest group of people get their insurance from an employer. The second largest group get their insurance through the government, primarily through Medicare and Medicaid. And the smallest number of people get their insurance directly from an insurance company. But regardless of where you get your insurance, there are some terms we have to understand. And we joke all the time at Triage Cancer that there should be a class in high school on health insurance and finances, because we all need to understand this stuff, but no one ever teaches us. And unfortunately, it's typically not until we get a serious diagnosis where we're trying to navigate this crazy system and figure it all out. So the premium is what you're going to pay each month just to have health insurance. The deductible is going to be based on your plan, but it's a fixed dollar amount that you're going to pay out of pocket each year. And you have to pay that deductible before your insurance company starts picking up anything for your healthcare expenses. Now, once you pay that deductible, the cost share kicks in, and that's a percentage, and that's the difference between what your insurance company has to pay and what you have to pay. Now, sometimes there's another payment called a copayment, and this is something like a $25 copayment when you go and see the doctor. So for one visit, you could have to pay a deductible, a copayment, and a coinsurance, and it can get pretty confusing. Now, finally, the most important thing I think people need to understand about their insurance is the out-of-pocket maximum. And this, again, is a fixed dollar amount, and it's theoretically the most you're going to pay out of pocket in a year for your health insurance. And the way you get to your out-of-pocket maximum is by adding up your deductible, your co-payments, and your coinsurance. So it's everything you pay out of pocket except that monthly premium. Now, I know that there have been questions. Our legal fellow, Danielle Purdue, has been at our booth, and she's been getting some questions about, well, why am I still getting payments or bills rather, even though I think I've hit my out-of-pocket maximum? And there might be a couple of reasons for that. The first reason is it might be a mistake, and we'll talk about how to deal with that. The second reason is typically insurance companies will only count payments made towards in-network providers towards that out-of-pocket maximum. So maybe is that provider out of network? And then finally, some employer plans can actually carve things out of their out-of-pocket maximum. So they might say, we're not going to count anything paid towards your deductible, towards your out-of-pocket maximum. So those are a couple of reasons why you might still be getting those bills. Now, this is an example of how this all works. And for the sake of time, I'm not going to go through it line by line. But I do want to tell you that at triagecancer.org, we have a series of animated videos. They're about 5 minutes long. They're in English and Spanish, a couple of other languages. And the goal is to give it to you in bite-sized pieces. So if you still have questions about how does the billing work in health insurance, that might be a great tool for you. Now, understanding what your options are for health insurance is sometimes a puzzle wrapped in an enigma, right? Like it is hard to figure out what your options are, especially if you've been used to getting your insurance through your parents, or you've been working and getting your insurance through your job, and all of a sudden that's not an option anymore. Where can you go for insurance? One option are the state health insurance marketplaces. Now, there's a huge misconception about these marketplaces that they are government insurance. People call us all the time and say, I have Obamacare, and we have to explain to them that isn't a thing. What you have is a private policy sold through the marketplace that the ACA created. And there are some significant benefits to us as consumers to purchase through the marketplaces, including a cap on the out-of-pocket maximum and potentially some financial assistance. Now, I do have a little bit of breaking news, relatively speaking, in that due to the pandemic, President Biden has reopened the marketplace for 36 states that use healthcare.gov. And so what that means right now is if you don't have insurance, or if you have a marketplace plan that isn't meeting your needs, like maybe you can't go see the doctors you want to see, you now have an opportunity free of penalty to switch plans, and there's extra financial assistance available. And so even if you looked at the marketplace's last open enrollment and it didn't seem like there were good options, or it was still really expensive for you, it might be worth taking a look again just to see what's available now in this new open enrollment period. And this is going to go through August 15th, so we still have a couple of months. Now, the 14 states that run their own marketplaces have reopened too, but the dates are slightly different. So if you're interested in one of those states, you can certainly check with the marketplace itself, or we have that information on our chart of state laws. Now, for people who were working and had to stop working and were eligible for Cobra to keep the exact same employer-sponsored insurance, I have some news. In addition to adding some financial assistance where 100% of the premiums would be paid for people on Cobra, there are some new opportunities to enroll in Cobra. So if you were Cobra eligible last year and didn't elect it because you're like, it was way too expensive, you might still have an option to go back and elect it and get your premiums paid for through September. And I know I'm going super fast and there's a lot of details here, but I'm also pointing you to the places on our website where you can get more of these details, and that blog is one of them. Now, for Medicare, Medicare is the government insurance for individuals over the age of 65 or for people who have been receiving SSDI for 2 years. Medicare is confusing, and a lot of people don't understand the basics, especially when they're under the age of 65 and sort of weren't even thinking about Medicare, but now due to a disability, that's in their realm. The short of it with Medicare is that really you have 2 lanes to drive in. The first lane is what's called original Medicare, where you pick up Part A for your hospital insurance, Part B for your medical insurance, so that's like doctor's visits and immunizations, Part D for your prescription drugs. But Part A and Part B have some pretty significant out-of-pocket costs. And so there's actually an additional insurance plan you could purchase called a Medigap plan. Now, I will admit that in some states, it is very hard to get a Medigap plan if you are under the age of 65. And so that is certainly an advocacy opportunity, which is something that at Triage Cancer, we spend a lot of time doing because we believe that our system is far from perfect. So that's lane 1 in original Medicare. And then lane 2 is what's called Medicare Advantage, or Part C. And these are plans sold by private insurance companies that bundle all of your Part A and Part B services together. So it's what most of us are familiar with HMOs and PPOs and a network. And most of these Part C plans also include prescription drugs. If they don't, you can pick up a standalone prescription drug plan. So I know that there's probably gonna be tons of questions, and that was like too fast to talk about Medicare, but all of that was to set up the point that we know it's complicated, and because we know it's complicated, we have tons of resources in a variety of formats. So we have webinars, we have quick guides, we have an animated video, we have Cancer Finances, which is our choose your own adventure website. So it'll pose you questions, and based on your answer to those questions, it takes you to the most targeted information. So you'll forgive me that I can't do more justice to Medicare. Then the other program I want to talk about is Medicaid. Medicaid government insurance program for individuals with low incomes, and in some states, low incomes and asset levels. Prior to the Affordable Care Act, you had to not only have a low income, you had to have a low asset level, which means like a retirement account or a savings account, and you had to fall into another category. In the cancer context, it was often through the Age Blind Disabled program, which we know is a terrible name, but it caused a lot of challenges for people. And so the Affordable Care Act created a 5th door for people to walk through into the Medicaid program that's just based on income. So if you have an income at or below 138% of the federal poverty level, you can have access to Medicaid. The problem is not all the states expanded. So again, if you're living in any of the states on the right-hand side, there's some opportunity for advocacy there. Now, when we talk about how do you make choices between plans, the problem is that you have to be able to do the math. And this is how you do the math. You take that monthly premium and multiply it by 12, and you add the out-of-pocket maximum. And when you do that, you can start to see what your annual costs would be in a worst-case scenario. But that's only half the battle, because you also have to look at things like deductibles and what's the network like? Because even if you pick the cheapest plan to you, if it doesn't cover any of your doctors, that's less helpful. And then certainly the prescription drug coverage. And as we get more oral therapies, that prescription drug coverage is going to continue to be a pretty big deal. Now, I mentioned for those people who are still getting bills after they've met the out-of-pocket maximum and might be wondering what to do about it, that's when we have to avail ourselves of the appeals process. And this is also probably really important for people who are potentially in a clinical trial or who are just receiving denials of care from their insurance company. There are multiple opportunities for us to appeal those decisions. And one of the challenges is that people aren't utilizing that appeals process. We know that of the people who are eligible, less than 0.2% of people are actually appealing. And so we've tried to create lots of different resources to both spread the word about the availability of appeals, but then to also help actually through the practical piece of that, including a brand new module on cancer finances that was released earlier this month that will start out by asking you what type of insurance you have, and then based on that, tell you exactly what you need to know to do the appeal. Now, I also mentioned that work is a pretty significant contributing factor to financial toxicity. And many times that's about needing to take time off. There are lots of places to go to look for our employment rights, including federal and state fair employment laws and federal and state leave laws. But also, if we're working under an employment contract or a member of a union, those contracts might provide added benefits. But what we find that people often forget is to look at their specific employer policies, because many times employers are much more generous than that bare minimum they have to provide. And so looking at what your employer is providing is always step one. Assuming that you've been able to take time off, or if you've had to leave your job entirely, what do you do to replace that lost income? Health insurance, if we're lucky enough to have it, is only going to cover medical expenses. What about all those other expenses? That's where disability insurance can be really useful. This is a different additional insurance policy that will supplement those lost wages. There are three main places to get disability insurance: from a private company, and sometimes that's a policy you just purchased yourself. Sometimes that's through your employer. There are 5 states in Puerto Rico that have short-term state disability insurance options. And then, of course, the federal options run through the Social Security Administration, which are both long-term disability insurance programs. They are somewhat confusing, particularly in their acronyms, but the two programs are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. And again, the 50,000-foot view here is that SSI eligibility is about having low income and low asset level. Typically, if someone is eligible for SSI, they are also eligible for Medicaid, compared with SSDI, which is about having worked for a certain amount of time and paid into the system. And after receiving SSDI for 2 years, someone becomes Medicare eligible. Now, don't ask me why you have to wait 2 years. We recognize that that's a challenge, a really practical challenge, and there are certainly some advocacy opportunities around that as well if you are interested. So I want to make sure we leave some time for questions. So what I'm going to, just the last couple slides are some other opportunities if you are interested to learn more about these topics and other topics. This year we are doing our Triage Cancer conferences all virtually. So we've just did one. Our next one is October 2nd. It's completely free to attend. You just have to go to this website and sign up before the deadline. We also provide continuing education for healthcare professionals if you think your healthcare professional should attend. And then we also have monthly webinars on a variety of topics. Again, these are all free to attend. You just have to sign up. But we also archive all of our old webinars so that if you've missed one, for example, and you want to learn more about Medicare, you can go check that out. You don't have to wait till we do it live next. Sometimes people prefer to read rather than attend events. I know we're all a little zoomed out. So in addition to our shorter quick guides, we have a practical guide to cancer rights that's downloadable on our website. And everything on our website is arranged by topic. So if you go to triagecancer.org, resources by topic, you pick the topic you're interested in learning about, and you'll see all of those resources related to that topic grouped together. But we also know that resources can only do so much, and sometimes you just need to ask a question. So if after you've tried to find the answer in the resources, you still have that question, you can fill out an online intake form at triagecancer.org, get help, and we will set up a 15 or 30-minute call with you and try to provide you with some answers to your questions. So I just wanted to give you all of that and then the ways to find us while I take a look. And Janelle, I lied to you. I said I was going to look at the chat box, and I didn't look at the chat box at all. So if there are questions, let me know.
I haven't seen any yet, but first, can you hear me?
Yeah.
Okay. So first off, thank you. Your information was amazing. Definitely hit home with a lot of topics that I need to research myself. So thank you for pointing us in the right direction there. Any other questions you guys may have, please go ahead and add them to the text here. But
if I manage to answer everybody's questions in 20 minutes, I think I've hit a new record.
Well, let's see. We have a few more. Okay, here's one. Is there a central location to view information on Medicare versus the Medicare Advantage plans? How do you start?
So what I would recommend is to start at cancerfinances.org and click on health insurance and follow the prompts, because we try to give you the pros and cons of the two programs. Also, we have animated videos that will be released in the next month that go over the two differences. But certainly if you still have questions, reach out and we can walk you through it.
Wonderful. Next question is, I'm getting laid off, and am I able to jump on my husband's work health insurance without an issue?
So first of all, I'm sorry that you're getting laid off. Second of all, it is possible. So we would need to know a couple of things, like, does your husband's job offer health insurance to dependents? And do they have a special enrollment period if you're losing your creditable coverage? But we also, I just want to mention, have both an animated video and a quick guide on options for when losing insurance at work that will give you kind of a rundown of all the different options and then how to make choices between those. Because we'd also want to make sure that whatever doctors you're seeing or prescription drugs that you're taking are going to be adequately covered under your husband's plan. Or would it maybe be better to get a marketplace plan? And so, that might be a great option. It might be good to just look at all the options before you jump into that.
Okay, we have another question. Are there any laws or rules about maintaining life or disability insurance that I have through work once I'm unable to work?
So it's different really because those are policies sold by private insurance companies. And unfortunately, there aren't the same protections with life and disability insurance that there are with health insurance. That being said, many times those policies will allow you to convert those policies from a group policy into an individual policy. So it might be worth your while to contact those companies and see what their rules are. But I will say, particularly with the life insurance piece, but with the disability insurance piece, people are often confused about how this all works if they're not working anymore. But usually, I'm generalizing here, as long as you were covered under the policy when your disability began, they will continue to pay out those benefits even if you're no longer employed. But even saying that, I'm going to still suggest that you go back to the company and find out specifics for your policy with that company.
Thank you. Here's one. Any tips for dealing with a review from Social Security? I guess there's a 3-year review. She's currently metastatic and has been stable for the past few years.
So reviews are, reviews happen. They are sort of par for the course. Sometimes people get a little worried because it's so hard to get SSDI or SSI, right? That like when a review comes up, it can be a little bit scary, but they are, I want to say, routine, for lack of a better word. Really what the key to both programs is it's not about documenting your illness or your diagnosis, but it's about how does that diagnosis and potentially the side effects from treatment impacting your ability to work. Because as we know, there are lots of people who have metastatic disease who still work. And so it's not enough just to say metastatic disease. It really has to be a focus on why is that impacting your ability to work. So I hope that's helpful, but if not, you know how to find us.
Yes. For SSDI, if I already retired early a couple of years ago to focus on my MBC and health, could I still enroll for those public benefits?
So I need to know what you mean by public benefits, but typically what happens is if somebody were on SSDI and then become retirement age, their SSDI benefits that they're receiving just convert into retirement benefits. It really is a pretty seamless conversion, because what SSDI essentially is, and I'm super oversimplifying, is you're tapping into those retirement benefits early, so to speak. So you can't, there's no way to get SSDI and Social Security retirement, if that makes sense, because it's essentially the same thing.
Wonderful. So we have about 5 minutes left. One more question. So if there's any other questions that anyone wants to get addressed, go ahead and throw those into the chat. But we have one last question here. Any advice on how to know if you're getting a prescription plan that will work for you? If you have no idea of what medications may be prescribed to you in the future or may change as frequently as every 3 months, are there programs that help with prescriptions when you transition to Medicare?
All great questions. So I'm going to start with the most general and then drill down. So generally speaking, for somebody who is already on a course of treatment, my recommendation is to talk to your healthcare team and say that you're trying to make health insurance decisions for next year. Can they not guarantee, obviously, because that's not possible, but do they have a sense of what the possible prescription drugs are that you would need? For example, if normal course of treatment is tamoxifen for the next 5 years, then you're going to want to make sure tamoxifen is on that drug formulary. So again, it's not foolproof. I'm certainly not saying it is, and there isn't really an easy answer there, but many times healthcare teams can say, well, these are kind of the 5 next most common things that might be prescribed to you. So to the extent that you can try to see if they're all on there. Now, if you do end up getting prescribed a drug that isn't covered by the formulary, it's not key, but there are to see if the insurance company Now, the same sort of thought process applies when you're switching to Medicare, looking at a Part D plan, because those Part D plans are sold by private insurance companies, and they all have slightly different formulary makeups and costs. And so it's really very similar in terms of concept of how you would look for a private policy, like in the marketplace, for example. Now, I will say both the marketplace and Medicare.gov have tools online for you to put in the name of the prescription drugs you're taking and the dosage and the frequency, and you get it from a mail order or a retail pharmacy, and then it'll actually help you filter out the plans that are available to you that provide coverage for those particular drugs. So again, it's still a lot of legwork, I admit that, but there are some additional tools there.
Great, great. Well, we have 2 minutes left. And, oh wait, let's see. We might have gotten a question, or it might have been, let's see. It's more of a good luck. Good luck with the meds.
So I just want to address, so Janelle, I'm sorry to interrupt you. I just wanted to address that, to what Stacey's comment is. I fully admit that none of this is 100% guarantee, and it is absolutely stressful. But I also know that many people don't avail themselves of the appeals process when they get a denial, mostly because they don't know about it. And it's one more thing that we are asking people who are already dealing with too many things to do. And so I 100% recognize that it's very easy for me to sit here and say, go appeal. But the practical piece of that is actually really challenging and a burden. And so I don't want it to be misconstrued that I am suggesting it is a super easy thing to do. But I do want to empower you that if you are faced with a denial, whether it be of a service or a provider or a prescription drug, that the appeals process, we know from the statistics, actually ends up being pretty successful for the people who do it.
Wonderful. That's a great way to end the session on, just to be an advocate for us and know that as challenging as it is that appeal process is there. And so I think that's an excellent way of ending our session here. And I would like to invite everyone to head on over to our closing, where we will highlight some of the amazing weekend and spend some time and special moments together. Thank you.